Are we good? Okay, great. I am gonna call to order the Community Health and Wellness Committee. I guess I need to do a board call. Dr. Blakesley? Sure. Dr. Varian?
Yep.
Dr. DePompe is absent. Mr. Shendrak?
Here.
That's everyone on the committee, okay. Can I have a motion to conduct business by voice vote unless a roll call vote is specifically required by our bylaws, state law, or is requested by a member of the board?
Moved.
Great. Dr. Blakesley? Mr. Varian? Mr. Sederek? Okay, great. Can I have?
Bill Lowry. I'm on the phone.
Hi, Mr. Lowry.
Hi.
I don't have to have him do a vote though, because you're not on this committee, so I don't have to call you as a roll call vote, but thank you for letting us know that you are here. All right. Can I have approval of the Community Health and Wellness Committee meeting minutes? Can I have a motion to approve CHW committee meeting minutes from October 9th, 2025? Motion. Second? Okay. All those in favor?
Aye.
Any opposed? Any abstentions? I think you have.
I wasn't here, so
Okay.
Abstain, okay.
All right, because I was the last committee chairperson, we do need to have a motion to elect a new chairperson of the Community Health and Wellness Committee. Do I have any? Dr. Blakesley, I think you were co-chair, right?
I don't know if I was, but
You were.
sure.
You were. Do you wanna take over as chair?
I've done it before, just FYI.
Sure.
Great. All right.
Second. No.
Can I have a motion to elect Dr. Blakesley as chairperson of the Community Health and Wellness Committee?
Moved.
Great. Second. Great. All those in favor?
Aye.
Any opposed? Any abstentions?
Congratulations.
Great. Now you get to get a vice chairperson.
Yeah, transitions in the moment.
Okay, great. All right. No, I'll do it. I'm making, you're gonna do that? Okay, great. Can I make a motion to elect Dr. Varian as vice chairperson of the Community Health and Wellness Committee?
Seconded.
All right. All those in favor? Any opposed? Any abstentions? All right, great. Programmatic update. Environmental health.
Tonight I wanted to give you just an update on our new HUD grant. The grant has been running for about a year now. The total award for the grant was $6.1 million. And the purpose of it was to do lead remediation in 120 homes in Summit County. It does include Akron, Barberton, and all the other communities, but we do most of our work in Akron and Barberton. Right now, we have 17 units in what we call our pipeline. So that's approved applications that are just waiting for a contractor to come in and work on home. And we have actually completed 3 units, which we are extremely happy about. So the grant is up and running, and the only reason I'm bringing this up is because it is one of the largest grants that we have at the agency. And also, if you know people that could get units, this is really, really good funding to take back to your communities and let them know that this funding is available for folks that need it, that have lead risks in their home. There are income guidelines. It is open to landlords that have tenants, and the income guidelines do work off of the tenant's income. So it's kind of a unique opportunity. It's also open to homeowners as well. So just throwing that out there. The second thing I would like to discuss today is just a brief overview of House Bill 692, and I do have a little synopsis here for you if you would like one. I do know that Chris put this as a link into, which had the full bill in it. He gave you that, so if you want to read the full bill in its entirety, it's 19 pages long. But there are some key updates that have been introduced in this House bill. I will let you know that there are about 10 steps before this would become law, and we are on step 2. So it's not something that, it's on the horizon, but it does appear to have some bipartisan support on it. And the way this kind of works is, you know, the House and the Senate will change the law, and then the Ohio Department of Health is responsible for coming in and updating the rules, which is what we work off of. So this is the law piece, and it's pretty unusual on an environmental health level that we have somebody go at these specific provisions. So I wanted to point out how it would affect our sewage program. The first thing that this bill does is it prohibits mandatory annual inspections. Inspections are limited to instances of probable cause or verified complaints. This actually does not affect us here at Summit County Health. We only do inspections when there's probable cause or verified complaints. Some other health departments do a mandatory annual inspection, so that wouldn't be an issue for us. The second part is a little bit about system installation and replacement. They are actually proposing that homeowners would be able to use, and designers would be able to use the soil absorption area, and if the soils have been disturbed. Up until this point, you have to have what's called in situ soil, so it would be like the naturally occurring soil. Anytime something gets disturbed, it affects how soil can work to absorb sewage. So they're trying to remove that requirement. And then the other thing they would like to change would be to allow boards of health to put systems on slopes, which now we're not permitted to do that. Because in general, what the research says is that it's not an effective way to treat just because of water flow. So they would change that. And then they would require that 12-month inspections, which is something that we do now by code, would not be required for newly installed systems. And this is a point that we actually agree on. We very rarely, as in never, find problems on those 12-month inspections. So what we do is the system gets installed, we go back 12 months later to ensure that it's working. And that's not really a pinch point for us, so we actually agree with that one. So anyway, I just thought I would throw this out there for you. It's not sweeping change, but there are some very pointed changes. And we do know that there are some areas of the state that don't have an adequate number of soil scientists. It's not mentioned on here, but that is another thing that they've kind of gone at here, is that they want people to be able to not require a soil review. So, and the reasoning is that often there's not enough soil scientists to do that. We have not found that problem in Summit County. We have enough soil scientists, and we do feel like it gives valuable information. So where it goes from here is it's in committee. It could move on, it could stall, but there will be, the groups that represent public health will come back and have comments on this. So OEHA will provide testimony. I don't know if we will provide testimony ourselves, but we do provide it through our groups. OEHA and AOHC will also provide opponent testimony.
Just a deregulation initiative.
It feels that way a bit. It feels like it's just a loosening of rules.
Who's the group or politicians that are?
They're out of the southern part of Ohio, where we do know that there are some people that have some issues with sewage rules. So they don't agree with the way health departments are mandated to operate. So their answer to that is that they will change the law.
Yeah.
So, yeah. So those are the two updates I have for you. If you feel compelled to look into that at all, or, contact your legislators on it, that's the information. Thank you, Ms. Murphy.
Clinical health?
There's been a lot of conversations surrounding funding, particularly related to clinical health grants over the past year. So I just wanted to go over the fact that the STI, HIV, and reproductive health services, we are funded. We have received all of the, I guess, expected funding that we had hoped for. We did get some reductions in funding, but we've been able to change some of our services around a little bit, put money in different spots than we had before, and really there's going to be very little impact to general fund, if at all. So we're real happy about that, because we worked very hard. We knew it was coming down the pipe, that we didn't have to make, so we did that really starting probably about a year ago. So I just wanted to let you know that those funding sources are all coming through, and actually the services that we deliver will still be the same. Shalita, oh, go ahead.
That's great news.
Yeah, it really is. Shalita, bless her heart, she is on maternity leave. She's the Family Health Division Director. And so I just had a couple of highlights that a couple of her managers gave me, particularly this month in community events that are going on, that might be of note, because you will see them probably posted. There is one of the infant vitality initiatives that's going on this month. There is a baby shower event. It's being held with Akron Pregnancy Services, again, focusing on pregnant women or women who have children under 1 year of age, providing them resources and things that they might need for the healthy beginning of that pregnancy and or birth of that child. There is a health and wellness fair that's held every year down at the Metro Transit Station. We've been an active participant in that for I can't tell you how many years. Harm Reduction always participates, and it's resources particularly targeted for minority groups, but we will be attending that also later this month. The Safe Routes to School, which you heard about probably a month or two ago, we get a small amount of funding from the DOT, I believe. Anyhow, they worked with one school in the city of Akron, and it's Mickey Bright, CLC, and this was new to me. They're having a bike helmet exchange, which I thought was really neat. So kids, they're young kids that have helmets and they outgrow them. If they bring to this event, if they bring their old helmet, they replace that helmet with a new helmet that's appropriate fitting. And again, this Safe Routes to School is to encourage children to ride their bikes for exercise, but also to ride their bikes to school and that type of thing. So that's an event that's happening later this month. And then they also have called a walk and roll held with Mickey Bright, CLC. And it's to promote active transportation and active movement. Again, if children ride their bikes or they walk to school, they receive incentives and resources for their families. So again, it's encouraging activity for young people and again, safe routes to school.
Thank you.
That's it.
Anything else? Does anybody have anything else to discuss? All right. Can I have a motion to adjourn the Community Health and Wellness Committee meeting?
Moved.
Second?
I'll second.
All those in favor?
Aye.
Any opposed? Any abstentions? All right.